Good morning, everyone. Good afternoon. Welcome to the 74th Emerging Growth Conference and day one of our two-day super virtual investor conference. I'm Anna Berry. Just a few notes. Today, we're running until about 5 p.m. Eastern. When we switch to the next company, you'll see a black screen for a moment. Don't go anywhere. It's just us moving over. But if you experience downtime for more than a minute or two, refresh your browser. Our platform does work best on Google Chrome. So if you're watching from an Apple device, you have to hit the play button to start the session. Now, all of our conferences are uploaded to our YouTube channel. Please subscribe, youtube.com/Emerging Growth Conference. Now, today, during each company's presentation, you can submit questions through the webcast module, and we will attempt to address as many of these as possible at the end of the presentation. All right, let's begin. We start with EUDA Health Holdings Limited. It trades on the NASDAQ under the ticker symbol EUDA. Led by CEO and Executive Director Kelvin Chen, EUDA Health Holdings Limited is a forward-thinking healthcare company dedicated to revolutionizing patient care. With a focus on innovative digital health solutions, EUDA aims to improve health outcomes and accessibility across the globe. Happy to welcome CEO Kelvin Chen. Welcome to the conference today, Kelvin.
Thanks, Anna. Okay. A bit about myself. I used to run this company called Healthway Medical in Singapore. It is actually Singapore's largest listed medical healthcare provider on the private space. And in 2019, we actually sold off that company, and I started this company called EUDA Health Holdings Limited. The aim of this company is to do something quite different from operating traditional clinics or hospitals in that setting. Rather, I think healthcare in the Asia region has grown quite significantly. The healthcare standards in Singapore are one of the best in the regions. But unfortunately, I think still healthcare costs are still rapidly increasing. And that's why we have created this company with some of the tech that we've founded proprietary to us to unburden some of these costs. Let me go into some details from there. So EUDA has three business models. One is actually what we know as secondary care, which is what we call our medical urgent care. These are treated by specialists, and basically what is the big difference from that compared to traditional models of HMOs or TPAs is that for EUDA itself, we have actually developed a proprietary tech system that not only reaches out to hospital partners or doctors, but it also reaches out to the allied health professionals and including the laboratories and radiology clinics and even implant clinics behind the support of these treatment. What it means is that usually traditionally when a patient goes to visit a doctor or hospital, usually the patient is actually prescribed all these services by the doctor and it's actually dictated to them, and the patient just goes wherever they are sent to. In our model, we actually have reached out to all these ancillary providers through our system. And the system actually uniquely picks through what is being presented to them from the patient's point of view, what's the patient's condition, picks the doctor, picks the hospital settings, including other things like day surgery centers or different types of implant providers. What a lot of patients and consumers do not know is that within a specialist clinic or within a hospital setting, there are different providers for radiology, for labs, for implants, for even medication. And these have different types of onset of pricing models actually. So in Singapore and even in places like Indonesia and even in Vietnam or Malaysia, within the hospital setting, there could be different types of surgery theaters as well. And the cost can be quite vastly different, could be even a 5 to 6 times difference depending on which theater is booked. Similarly, for the patient doing their radiology, their x-rays, their MRIs, there are different labs and radiology centers that have different pricing, which patients may not know of. So we actually have a mix through our model. We actually go through the system and we find out which doctor is accredited to perform surgery at which particular center. And then we actually pair it up with sending them to the available radiology clinic, which perhaps has a lower cost and all these. And in whole, what it happens is that through connecting the patients with all these other ancillary providers, we actually managed to lower the healthcare costs by at least 40 to 50%. So that's the first step on our medical urgent care model, which is actually doing a lot of evacuation work, assistance, and specialist referrals. So healthcare usually has three different models. One is primary care, which is your general practitioner. Then we have your secondary care, which is your specialist. And then as well as we have what we call our tertiary care, which is your hospital section. So EUDA has started off on lowering the healthcare costs quite successfully on the first model of medical urgent care. And I think this year what we have done is we have actually acquired a company in Malaysia for $15 million to advance our role in what we call our wellness or allied health care section. So there are patients who perhaps like to defer certain surgeries, and after seeing our doctors may have the opinion that these patients may not urgently require such services. They may choose to seek other types of treatment like physiotherapy and different types of wellness. So we have actually acquired a company in Malaysia which has a unique model of providing bioenergy capsules as well as certain supplement products that can help our patients who do not need surgery cope with these treatment. I'll go into that a bit more from there. On our third model, what we have is what we call our virtual clinic model in Singapore, actually. So I think everyone knows about what telemedicine is like. There are a lot of telemedicine providers out there. We do have telemedicine in our system as well, but this is coupled with what we call our virtual clinic. And what the difference is that there are a lot of telemedicine companies in Asia at the moment, and in Singapore as well. But unfortunately, the cost for delivery of this medicine, it's quite high in Asia, and that doesn't help the consumer at their end, actually. It provides convenience, but it actually adds more cost burden to them. And what we see coming up is that a lot of patients visit their doctors in their heartlands rather than go to their hospitals compared to 10, 20 years ago when they had no choice. So we see a lot of clinics coming up in the heartland communities, places near to our patients' homes and all that. So EUDA actually has partnered with 40 over different property providers to add on what we call our virtual clinics at all these property sites, which adds on healthcare to the community as well. So our patients within their home community can just come downstairs to their block or their condominium to seek treatments at our virtual clinics. And there will be a healthcare assistant helping them to take some of their results, their pulses, and all these other things. And some of these results can only be taken in person rather than just by telemedicine. So telemedicine can only see a certain portion of patients, but we aim to see what we can see on a whole at a traditional GP clinic as well. So these are the three models that EUDA is going to be rolling out over the course of the next 3 years. So I think like what Anna mentioned, EUDA is listed on the NASDAQ. I think there are certain key points that we like to emphasize on that, on the innovative, the proprietary tax solutions that we have. We actually have a system, like I mentioned earlier, called Alice, that is proprietary by us, that actually helps to lower the healthcare costs, connects to all providers, and including that, all the providers that are with us, we actually have a proprietary clinic-based management system that we actually roll out to them for them to use to record their patient data, and it comes back to us in terms of feedback on lowering costs, on working with insurance providers, on cutting some of these paperwork and all these other things. And we do have the different types of revenue streams from our primary care services to our wellness and urgent care services, as well as the virtual clinic as well. So like I previously mentioned when I first did the introduction, one of the main aims for EUDA is to lower healthcare spending costs. And I think we've done so with our Alice system and done so for our secondary care quite well. We have done it in Singapore quite successfully, and we plan to roll this out in other countries such as Malaysia, Vietnam, and in the later part, including the United States and Canada as well. So what happens is that I think in terms of healthcare, we will look to integrate from primary care to secondary care to tertiary care to allied care, all in our system, so that our patients have the best quality of care. Right now, we see a large number of corporate companies, and we have probably around 2,000 corporate companies, and a vast number of their employees are with us uploaded in our system. Right now, we only see the secondary care portion or the specialist care portion of them. And what we plan to roll out is that the entire continuity of healthcare for our patients, we plan to integrate that all in one into our system with the use of our AI and machine learning to radically change how they receive treatment, not just in terms of convenience, but in terms of costing as well. So a bit about the AI and the virtual learning that we have. So in terms of even things like our virtual clinics, in terms of seeing patients for our secondary care, for our urgent care system, once we seek the patient through our app or in person at our clinic, the system actually connects to all these allied care health professionals, matches them up to lower cost, as well as check whether they have the different types of supplements and implants or even blood at the certain clinics. So this has speed up the quality of healthcare or the quality of us being able to send patients to in a very different manner. And I think that's something that's quite different from something that no other company has done in Asia. And I think this is something quite unique, and we hope that this will change what is currently the brick and mortar treatment for healthcare in the region. And this is one of just the small steps that we are going ahead on that. Even in terms of things like mental wellness and all that, there are a lot of traditional models that have been rolled out in the past years, and we hope that our software and our different type of machine learning can help to change all these, and potentially patients that are with us, our consumers, our corporates, will have a difference in terms of quality and a difference in terms of on what they need for their treatment, rather than them holding on to their treatment and perhaps not wanting to go ahead with it because of the cost of the treatment. We hope that we can do a radical change to that by providing them better outcomes, long-term cost savings, not just make it convenient and timely, but mainly so that they can faster access to these treatments, and that in turn will be able to change their livelihood and their convenience as they go about their daily lives. So we have put about a good team of healthcare professionals. Myself, we have Anthony, we have our CFO on board, and we have a good team of people with large experience of healthcare and health tech needs in terms of policies and all that to be able to go about on these changes. So like what I mentioned on earlier, we do have a very diversified revenue stream. I think one of the main things that we have put in, of course, is our wellness capsules. These are bioenergy capsules that have been rolled out in Malaysia so far. And we do have exclusive distributorship over these capsules. It is the tech in there is proprietary to us. And it does help with a lot of allied health care treatments. And it does couple with a lot of post-surgery treatments as well. So in terms of these machines, we plan to roll out as many as 400 of them in Asia by the end of 2024, and as much as 1,002 early next year to expand to countries such as Vietnam, United States, and Canada as well. These will be coupled all together with our virtual clinics so that when the patients come into our properties to see our doctors, they can do their blood testing, they can see what are the problems they have, be diagnosed, and then if the diagnosis is that they can seek treatment by our capsule, then they will be provided at their place of convenience to be able to seek treatment with the capsule itself. And this capsule, I think it's going to be something that's going to be quite a game changer for us on the allied healthcare portion. In Asia, we do see a lot of patients with diabetes, with gout, with chronic joint problems. And these are things that will be able to be treated with our bioenergy capsules. So this is the company that we have acquired in Malaysia called CK Health Plus. And we acquired it for 15 million USD a few months ago. And we plan to roll this out quite rapidly. What comes along with this is not just the proprietary capsules that we have, but also a contract for supplements such as collagen supplements with the company called EUDA. And these supplements are actually exclusively going to be distributed by EUDA in Asia and in the United States as well. So some of the new things that we are coming out for not just Asia would be our bioenergy products, our supplements, and like I mentioned on the capsule, it infuses certain thermal matrix with light resonance therapy to roll out the treatment for our patients. And these are actually very good for post-surgery therapy, and we think that there is a large number of patients that can be treated with all these coupled with traditional medication as well. So it's not to say that we are dispersing traditional healthcare. We will still have our virtual clinics where our general practitioners would see patients at these clinics, and if their treatment is required for medication and some of these other things, then they will be treated with that. However, patients who need to go about with extra supplements, go about their life with certain other treatments that can be treated without strong medication and all that, we'll be able to recommend them for our bioenergy capsules. And we plan to roll this out in quite a big fashion, and we've seen quite big demand in Malaysia, in the first country that we've rolled it out already. So I think in terms of EUDA share price and market value, we have seen a strong growth in the past few months, especially since we've rolled out our bioenergy capsules and acquisitions in Malaysia. And I think with the strong revenue growth that we are projecting in terms of our capsules, we look to see a big increase in our revenue over the upcoming years. And even with coupled with our urgent care and our virtual clinics, we do look to see that our revenue should grow to more than 100 million in the next 2 to 3 years. So I think that it's great value in the company, and we will continue to roll out our services and perhaps expand on more services in the upcoming years. Of course, the underlying core for EUDA is not just to roll out good healthcare treatments for our patients, but also to lower the healthcare costs for them and make treatment easier and more accessible to our users. So in terms of market growth, I think in terms of the next 3 years, we are looking to roll out to countries like Malaysia, Vietnam, Canada, the United States. And beyond that, we have partners that we are speaking to in places like Indonesia, in Philippines, in Thailand, that have shown strong interest in the products that we are launching. Of course, on our software base, we are looking to customize it for these markets. And as soon as it's done and it's accessible, we will look to roll out to these markets as well. So in terms of investments in EUDA, I think I would say that we have a very good game plan with a very good team. And going ahead, we look to strengthen the company as well, roll out rapidly our services in terms of places like even China as well. We have good partners there, and I think in our second or third year in rolling out these services, we look to integrate it all together with our AI, and we do see all these coming together quite rapidly, and we think that the company will perform even better, not just on operations or providing healthcare services wise, but as well as even on our share price as well. Yeah, so that's all from me. Thank you. Back to you, Anna.
Great. Thank you so much, Kelvin. We have a few questions for you. You recently acquired a new company in Malaysia. So share a little bit more about that acquisition and how it aligns with your growth strategy.
Okay, so like what I mentioned previously, what EUDA used to provide was basically very traditional medication. So very core traditional medication in terms of general practitioners, in terms of secondary care, in terms of specialist services. We used to not have allied care services such as physiotherapy and non-medical services. There are a great number of patients who we see that perhaps do not need such services. First, patients who are diabetic, patients who are gout, that require certain treatment. Perhaps they need some light medication, but they could be treated in other manners as well. So we bought into this company, which has a very proprietary bioenergy capsule that will help patients basically with their outcome and treatment, and basically help them condition their problems as well. And we have seen a lot of very high take-up rate for these patients, and we've seen very good results for them. So we see the sales in this next quarter coming up very strongly until the end of the year, and we look to still rapidly expand from there. Also, what has been included with the acquisition of this Malaysian company is the 2 exclusive distributorship agreements that we have with Royal on our range of collagen supplements for both male and female. And this, coupled with our capsule treatment, we think it's a very strong ecosystem that we have to be able to provide not just medical healthcare, but allied health services as well. Yeah.
Well, with what you just said, what are the key markets or regions you see as pivotal to EUDA's growth over the next few years, and why?
So I think we will still expand in Asia first over the course of the next half of this year. We see markets like Malaysia, we have very strong partners there. Vietnam, we have seen quite good support for that, including not only our corporates, but our partners as well, who are very keen to take up these treatments. Our software has also been customized for all these countries as well. And of course, China is a very good country which has a large population that has a lot of dealings with non-medical healthcare in terms of their traditional medication as well. We think this technology will be very successful there as well. Then, of course, in the further part, we look to move some of these to the United States and Canada as well. So we see some of these Asia countries as very strong growth markets for EUDA. And definitely on the later part, we want to bring this to the States and as well.
Now, with the rapid expansion of digital healthcare, how is EUDA addressing the challenges of data privacy and cybersecurity in your offerings?
So I think EUDA has a few different measures that we've taken for data privacy, for security. We look to have our Patient Protection Act. We have multiple factors for authentication, for security. And of course, we do have our AI and machine learning that looks to see whichever threats are coming into our patient database when there are cyber attacks and all these other things. And we definitely train all our staff to make sure that they comply with the different settings that we have on patient security, on filing, on submission for procedures to our insurers and all these other things. We have different authentication modules that we work with our IT team on those to make sure that they are on a global level as well.
And what do you see as the biggest challenge in the industry, and how are you positioned to address it?
I would say that in terms of traditional healthcare, we see the healthcare standards or the treatments growing very rapidly in the region. Things like proton treatment for oncology, all these things are really very exciting, and we see them advancing healthcare very well. Not just in Singapore, but even in places like Thailand, even in Indonesia, even in Vietnam, we see different facilities, different types of equipment, and different types of surgical standards and treatments being advanced in terms of robotics and all these other things. So the one thing we see is that while all these different treatment options are growing and advancing throughout the years, unfortunately, the cost of healthcare is going up as well. And this burden has always been presented to both the insurers as well as the consumers directly. What EUDA hopes to do is to couple with all these new technologies, but lower the costs quite fundamentally so that a lot of the consumers and patients that we have that come to us will be able to get their treatment in a much faster and more economical model, rather than for them to delay their treatment because of the rising cost of healthcare. So I think in terms of the AI and the machine learning that we have on our Alice system, and including our clinical management system that we have that's proprietary to EUDA, we hope to couple all these different parts together to actually make a big change in the healthcare industry in the region.
And with that, Kelvin, what closing remarks do you have for our viewers today?
I would say that in terms of healthcare treatments, in terms of reaching out to your healthcare providers, there are always different forms of reaching out to them and different conveniences out there. Don't delay your healthcare costs. There's always, health is always a very big thing in our lives. There's a lot of things that you would suffer for, you wouldn't be able to do if you are not in the best place of health. So take care of your health first. And of course, in terms of our investors and all that out there, I would say that EUDA has a very strong position to become a market leader, not just in Asia, but in the world as well, where we will slowly bring all our different types of tech and partners to combine to go ahead on that.
Wonderful. Well, Kelvin, thank you so much for joining us on the conference, and we hope you join us again in the near future with some updates.
Great. Thanks, Anna.
All right, everyone, stay with us. We'll be right back with the next presenter.